and thank you for joining me for this short presentation on our emotional wellness program. The emotional wellness program at the Traveling Therapist is primarily focused on providing support and education to residents, staff, and family members of those who participate in assisted living facilities, independent living facilities, and 55 and older communities. Our licensed clinical therapists are trained in dementia, end of life, and cognitive behavioral therapy to provide support and coping tools that can help your residents gain the understanding and the emotional wellness they need to face the many challenges that come with transitioning to this new lifestyle. Some of the areas that we work with is changes from moving into the facility to losing a loved one to now the most recent, the COVID-19 pandemic. We understand that the emotional and psychological well-being of your residents are a top priority and make a huge difference in how well they can adjust and become familiar with the facility and the staff. It also plays a big role on how well the family can feel comfortable and secure in choosing the facility for their loved ones. Our licensed clinicians provide education to the family members and support when they need it, whether it's to work through the difficult process of letting go of mom or dad, making that tough decision of placement where sometimes there's guilt, shame, there's broken promises, broken trust, and oftentimes the facility is the one that takes the brunt of it. We provide staff support through groups. We are involved with the clinical staff directly. And even though we do not prescribe medication, we do work in tandem with the psychiatry group, which may be in the facility already contracted. We are different from psychiatry in that even though we do not provide medication, our focus is on the emotional stability of the resident and the family, and the education and support of the staff, where they might feel like they have an advocate that can help when the family or the resident perhaps is struggling to face reality and the many changes that come with aging. Our program is completely covered by insurance. We handle all billing matters on our side, all documentation, all processing. All that is required is a simple referral, whether it's a faxed face sheet or email or a text message letting us know that you're interested in connecting with us and that you're interested in referring someone to us. We provide the paperwork and follow up with the family member and the residents so that you don't have to worry about the paperwork. The facility will never be held accountable for billing, and neither will the family or the resident. Okay, now let's move on to some of our commonly asked questions. One of the most common questions that we get asked is, what happens if there's already psychiatry contract in the building? Our therapist and the services that we provide are billed completely separate from psychiatry. We do not have a crossover with physical therapy, occupational therapy, home health, or psychiatry. As long as the psychiatrist and the therapist see the patient on different days, it can be the same patient without any issues. Another common question is, how often do we go and visit? Typically, we go once a week for 30 to 45 minutes, and we will either do a face-to-face if it's possible, or we will do a phone or a Zoom conference with the person. Another common question is, are we able to talk to the family? We contact the family once a month at a minimum via email to update them of our progress and any concerns or suggestions that the facility may ask us to provide. Now, if there are more difficult situations or more complicated situations, then we contact the family as necessary. There are family members that actually end up becoming our patients because they are having a great deal of difficulty managing the process of change or the loss of their loved one. In those cases, we provide therapy directly to the family, we get their paperwork, and we work through their insurance. Or if the loved one and the resident is still alive and present, we can actually use the resident's insurance if necessary. Again, at no cost to the facility or the resident. Another common question is, what do we do for the staff? We provide copies of our notes every month, every visit that we do. We also are happy to participate in staff meetings, in treatment plans meetings, especially if the family is involved and you feel that our feedback would be valuable. We provide groups and training according to what the resident needs. A common question that we get asked is, what do we do with the residents? The licensed therapist goes in, uses supportive listening, active problem solving, and coping tools to teach the person how to manage their anxiety, depression, how to come out of their room and not isolate or withdraw. Right now, with the COVID pandemic, a lot of people have to isolate. They don't have a choice, especially in facilities. That often creates a higher level of depression and anxiety. People are not sure what's going to happen. The news are constantly running very negative ads and making people feel scared and worried and unsure. In those moments, that's when the therapist comes in and works by educating the resident on many different coping tools that they can do to manage a sense of anxiety, identify triggers, and identify ways that they can help themselves, empower themselves, and be supportive of themselves during this difficult time. It also helps because it's nice to be able to have someone who is a trained therapist providing you support for a full 30 to 45 minutes where you have the ability to talk about anything that you're worried or concerned about. And with empathy and supportive listening, we provide you with the support and the attention that you need. Well, I swear I was going to keep this short. So I thank you for listening, and I hope that if you're interested in our emotional wellness program, you give us a call. You can call me directly, Yalili Smith, at 239-354-7227. Or you can visit our website, thetravelingtherapist.net, or email me at travelingtherapist1@gmail.com. You have a wonderful day and stay safe.